Good evening. Black cab drivers waiting hours for passengers, restaurant workers unable to make shifts and confusion for commuters. On a day when thousands should have been returning to work after the Christmas break, those coming into London were told not to do so by rail. The network is facing the worst week of disruption for 30 years. Members of the RMT union have begun their first of two 48-hour walkouts in a dispute that's been raging since June over pay and conditions. ASLEF drivers working for 15 rail companies are walking out on Thursday. There are hints, though, that a deal could be near. Here's our political correspondent, Simon Harris.
In the City of London, there were echoes of lockdown. More than 500,000 people work in the financial square mile. But today it was a ghost town with quiet streets and empty pavements. Instead of a torrent of city workers crossing London Bridge, there was a trickle.
It took me not twice as long to get here. So, yeah, not happy.
I managed to get a train, but it was absolutely heaving. I mean, people were crushed in, there's a bit of shouting going on.
I'll be more affected on Thursday when I'm going to have no trains at all.
For those able to work from home, the strike meant an extended Christmas break away from the office. That was of no comfort to staff at this city barber's shop.
It means that more people are working at home, so therefore it's had an impact on us, whereas a lot more quieter. So hopefully as time goes on, more people should be coming in. But at the moment, it's very quiet in London Market, so we have to see how things go.
Outside Liverpool Street Station, cabbies waited and waited.
It's not good for us. We're going to sit here for, maybe 2 hours to get a job.
Doesn't look like there's many people in the city today, does it?
Less passengers, less people about. It has a great impact on our daily earnings. It affects me every day. It means I've got to work longer.
In the Exmouth Arms in Clerkenwell, lunchtime was a write-off. At a restaurant just along the street, the shortage of punters was just one of the problems.
We've already got a very strained staffing situation in the hospitality industry that is being exasperated by the train strikes, with people unable to get to work or turning up several hours late.
For a while, the picket line at Liverpool Street was abandoned, but it was pouring with rain, and the RMT boss insisted the strike was solid.
If you go around the picket lines around Britain, our members are out in force. The railway has been severely impacted by the strike action they're undertaking.
Some trains were running. The Elizabeth line had a good service on the central section, but there were no through trains from Berkshire or Essex. Ministers argue the strikes aren't just having an impact on the economy today. They warn of long-term damage to the railways as passengers give up on train travel. Even without strikes, there are 40% fewer commuters using trains than before the pandemic.
There's only going to be a sustainable future for our rail service if we can get people back using the trains, we can drive up those passenger numbers, drive up the revenues going into the system, and that's only going to be done by a reliable railway. So these strikes are going to damage the industry.
At times, the departure boards at some London stations looked respectable, but by this evening, most lines had come to a standstill. There's more of the same tomorrow and the rest of the week. Simon Harris, ITV News, Liverpool Street.
Next tonight, the amount of time patients spent waiting in a London ambulance outside hospital increased by more than 10% in December compared to the previous month. The figures come as the Prime Minister said he would take urgent action to help the NHS, but with patients waiting on beds in corridors and GPs driving people to hospital to avoid long ambulance waits, does that help come too late? Well, one patient who told us she had to wait for 2 hours for an ambulance after an asthma attack, only to be left in the corridor at Queen's Hospital for even longer. Our political correspondent Simon Harris reports.
A&E staff at Queen's are used to being on the front line. Every year, the hospital in Romford treats 150,000 emergency patients. But when Susie, a mother of 3, arrived in an ambulance last week after suffering a severe asthma attack at home in Rainham, she found herself in a crowded corridor.
Over 15 plus patients lined up in the corridor, some of which had had serious heart attacks, strokes, none of which were being looked after by nurses. They were being stood over by paramedic staff, one paramedic staff per 6 beds, might I add. No privacy, no dignity for the patients.
This picture of beds in a corridor at Queen's was taken by the daughter-in-law of a 94-year-old cancer patient. Like many hospitals, Queen's invites patients to submit reviews of their treatment to a website. It's a sort of TripAdvisor for healthcare, and the last few days reveals some disturbing stories. One person wrote, "My son was suicidal and left for over 9 hours in A&E waiting for a mental health person to see him. The department was heaving and a totally unacceptable environment for someone in that vulnerable state." Another said, "I would describe it as being in a war zone. I would not recommend this service to my worst enemy." How scared were you?
I was petrified. I was scared for my life.
No one at Queen's was willing to talk to us, but the chief executive of Barking, Havering and Redbridge University Hospitals NHS Trust gave us a statement. Matthew Traynor said, "We're sorry some of our patients are being cared for in corridors. It's not fair on them or our staff, who are doing a fantastic job in very challenging circumstances." Figures from the NHS show the delay in offloading patients from ambulances at London hospitals has gone up by almost 12% in a month. 2,500 hours were lost in 1 week alone in December.
It's been building up. This is like when it comes to the boiling point, tipping point. It didn't just happen since the pandemic. It's been building up. An example, when I joined the service, there was, I don't know, an average of about 2,000 calls a day. Now there's probably an average of 6,000 calls.
Today, the Prime Minister said the government was working to clear the backlog.
The most pressing priority we have is to move people into social care into the communities. That will mean that we can actually get ambulances flowing as fast as we would like and make sure that people are moving into A&E as quickly as we would like them to be seen.
Susie said she didn't blame the staff at Queen's, describing them as panicked, stressed and overworked. Simon Harris, ITV News, Romford.
Good evening. London was dealing with yet another train strike today, with virtually no trains in and out of the capital. Members of ASLEF and at 15 rail companies walked out in a dispute over paying conditions. It comes as the boss of the Train Drivers Union warned that any attempt by the government to bring in new anti-strike laws could intensify the industrial action. Our reporter Carolyn Sim is at Wolseley Station for us, where she will have the latest on the dispute in just a moment. But it's not just in the city and central London where the impact is being felt. London's commuter towns are also bearing the brunt. For example, Guildford. It hasn't had a train all week. Businesses have lost money and people have been forced to work from home, as our political correspondent Simon Harris reports.
The trains on platforms 2, 5 and 6 were going nowhere. Guildford is the Surrey commuter town where the trains stopped running on Monday and won't restart until Sunday. This was day 3 of rail strike ping-pong between the RMT and ASLEF. Guildford without trains is like turning the clock back almost 2 centuries. The railways came to Guildford 180 years ago. Today, more than 4 million passengers a year pass through the station. It's a lifeline for commuters and the city's economy. On the station forecourt, a forlorn queue of cabs waited for passengers who didn't exist.
I spent 7.5 hours here yesterday, 3 jobs, £42.
What can you do with £42?
It doesn't even cover my outgoings. You know, our cost is about £50, £60 a day here.
It's no good for anybody. Strike is not the solution. It's never a solution. It's all disrupted and people are, struggling.
Alex manages a sales team for a tech firm in London and is a regular commuter. He was supposed to be having lunch with a client. Instead, he was stuck at home.
These train strikes have really sort of hit us quite hard, and it feels like it's been going on for quite a while this time round. And it's really frustrating because you can't get up to London, you can't get to the place of work, and you can't see things or do things that you would otherwise want to do.
Guildford's Tory MP backs new laws to make it harder for unions to disrupt public transport.
One of the things that people think about with Guildford, it's a commuter town that people must be travelling into London. What they don't appreciate is that there are people who are travelling into Guildford to work in some of our important key services. We've got a hospital here, we've got a university, we've got teachers who need to come into work. They can't all afford to live in Guildford, and so they have to travel in.
Some were forced to go the long way round, hitching a ride on an airport shuttle bus to a distant tube station.
I'm travelling to London, and because there's no train available, so I had to catch the bus.
Where will the bus take you to?
Heathrow.
Today it was the drivers on strike. Tomorrow and Saturday it's signallers and station staff. In Guildford it amounts to the same thing, no trains. Simon Harris, ITV News, Guildford.